Madam President, for a number of years, we have been debating health care in this country. Clearly, our health care system had problems 8 years ago. They started to do health care reform. I saw that as a doctor practicing in Casper, Wyoming. Well, then Washington Democrats tried their solution. It's a solution that passed, and it was been known as Obamacare. Republicans said it wouldn't work, and we have been proven right. Obamacare is too costly. It is collapsing. And it's interesting, Madam President, because yesterday, as we were having our policy lunch meetings, Republicans and Democrats, word came out that another one of the Obamacare exchange companies, this time in Ohio, Anthem, was pulling out, leaving about 18 counties, if not more, in Ohio without anybody to sell insurance on the Obamacare exchange. So Obamacare actually hadn't solved the problems of America's health care system. In many ways, it made matters worse. That's why the law has never really had the support of the American people and continues to be unpopular today. It's why more than 19 million people actually chose not to sign up for Obamacare coverage at all, even in spite of financial incentives to do so, and a fine or a tax if you didn't sign up. So they either paid the fine, they got an exemption, and the Democrats, when they come to the floor to talk about health care, refuse to talk about those 19 million people who just said, we want nothing to do with Obamacare, we're not going to sign up, give us an exemption, let us out. They want to talk about people that they actually have covered by pushing them into a broken Medicaid system. And that's about what's happened here. This expansion through the health care law and expanding Medicaid put many people on a broken health care system called Medicaid. It wasn't working well before Obamacare, and it's gotten worse. The numbers out there in terms of physicians taking care of patients, about 1/3, 1 out of 3 doctors won't take new Medicaid patients. So it's not a system that's working. It's not a solution. But Democrats put more people into that. For people who didn't end up in Medicaid, who pay their premiums, those premiums have gone up significantly, doubled in most states, I think across the board, about 107% up over the last 4 years. That's the statistics that come out from the Department of Health and Human Services recently, the statistics that the Obama administration, as it left office, didn't want the American people to see, that rates have doubled across the country, in some states much, much higher than that. In my home state of Wyoming, they were up actually higher than the national average has been up. People are paying more and more. There were 2 companies at one point that were selling insurance on the Obamacare exchange, both losing money. One lost so much that they're no longer in business. The other still losing money and still selling on the exchange, but you wonder how long they'll stay. Or will they do the sort of things that Anthem had to do in Ohio and the sort of things that we've seen, Madam President, in your home state of Iowa, and we've seen in Nebraska, and we've seen across the board. Now, some Democrats say this is a one-term correction, give it time, but it doesn't seem that it's going to be working that way. There was an article in the paper here in Washington, Roll Call, and the headline was, this was last week, insurers seek increases for Obamacare premiums in early filings. This is for next year. So the article talked about how the insurance companies are starting to say how much they're going to need to charge people next year, which is much higher than it is this year. They're talking about an average increase of about 30%. The average premium in the Obamacare market in Wyoming right now is already more than $7,000 a year for a family. So how much more can people take? And that's why I continue to come to the floor and talk about what's the problem with the health care law. The health care in the system, people under Obamacare have seen their deductibles go up, their co-pays go up, the choices that they have go down. And this is the real problem when we talk about Obamacare. And then, of course, the other thing is taxes. There are at least 15 new or higher taxes under Obamacare. So people aren't just paying higher premiums, they're paying higher taxes, which are supposed to help with the premiums, but it doesn't seem to be doing so for people all across the country. The Congressional Budget Office has looked at this, and it said that the Americans are going to pay more than $28 billion over the next 10 years on just one tax on prescription drugs. Well, if we're trying to lower the cost of drugs and trying to lower the cost of care, putting a tax like this, as Obamacare did, on prescription drugs just adds to the problem. It has raised taxes all across the board. And I don't want to go through each and every one of the taxes, but suffice it to say When President Obama said he would put this program into place and it wouldn't cost a single dime, he forgot the $1 trillion in new taxes that he added onto the backs of hardworking Americans. And so we've had higher taxes, we've had higher premiums, we've had higher out-of-pocket costs from people, this huge tax burden. So what has happened is we need to do a reform. The House has passed reform, and now in the Senate we're working on passing our own health care reform bill. We've been meeting 3 times a week, up to over 5 hours a week for the last month and a half, going through piece by piece all the different components of the health care law, trying to address the issues that are facing the American people, trying to lower the taxes that top the list of what we hear about at home in terms of trying to help people because they're paying more taxes, trying to work to deal with premiums. And I'm really encouraged, Madam President, by the debate we've been having. I think we've been taking good steps in trying to address the issues that the American public are seeing in terms of higher premiums and fewer choices. So I'd like to work with the Democrats to solve these problems in a bipartisan way, to talk about how people can actually get health care in this country. But what have the Democrats done in response? Well, it's interesting because they want to go to a single-payer health care system. Now, some may deny it, but a majority of the Democrats in the House have co-sponsored legislation to go to a single-payer health care plan. And it's modeled in some ways after what you're seeing in California. The California State Senate, Madam President, last week passed a bill which seems to be the drift and the direction and maybe even the tip of the spear of the Democrat Party efforts. It said we want single-payer health care in California. And, you know, I served, Madam President, in the state Senate in Wyoming. I know you served in the state legislative body in your home state in Iowa. We do a fiscal note. We say, what's this going to cost? You know, is it a good idea? Can we afford it? What are the costs going to be? And the cost for what they proposed in California is $400 billion. $400 billion. So you say, well, then can they afford it? Well, what's the total budget of the state of California? What's their general fund for the year? It's only $190 billion. So what they're proposing for health care alone is over twice what the entire general fund of the entire state of California is. And yet it passed. The party line vote in the state of California in the state Senate, but that's now the position that they're working to do. So, you know, it's hard to get cooperation from somebody to work on dealing with a health care plan when their plan is to go more government, more spending, money that they don't have. Because when they looked at it in California, they said if we want to do this, they would have to, one, cut funding on other things. You think about where general fund money goes, whether it's teachers, law enforcement, public safety, firefighters. But also, they'd have to raise taxes significantly to get the money for what they want to promise everybody in this single-payer health care plan. So I'm interested in working in a bipartisan way with people, but it's hard to get that kind of cooperation where their solution is more government, higher taxes, less freedom. We need a solution, and that's what we're working on, and I'm very happy to say has been discussed at length in our conference, another good meeting about it yesterday, along with the Vice President, focusing on eliminating taxes, getting rid of the mandate that says the government, that people must buy a government-approved product, and give people additional choices, give the states flexibility to make a number of these decisions. Madam President, I'm from a state where agriculture plays a significant role, as are you. I'm going to be at our Wyoming stock growers meeting on Friday when I'm back home in the state. And it was there a couple of years ago after Obamacare passed, talking to people who had insurance that worked for them, worked for their family, but they lost it, not because they couldn't afford to pay for what they had, but because President Obama and what the Democrats forced through in Congress said it wasn't good enough for them. Under the mandate, what my friends and family, what my friends and neighbors, folks around Wyoming have been saying was good enough for them and they could afford, President Obama said wasn't good enough for them. Well, who's a better judge, Madam President, I ask you, of what's good for a family in Iowa or in Wyoming? President Obama and the Democrats, or the family there in Iowa or Wyoming who's making the decision about what works best for them and their families? And I'm sure I'm going to hear more about it at the stock growers meeting in Wyoming on Friday, when I hear from families that say, you know, what we had worked, but we lost it because it wasn't allowed to be sold anymore. The president said it wasn't good enough for me. And as one woman said to me, tell the president that I can make the decisions for myself. I don't need his help, to President Obama. So we're going to continue to work toward the goal of making sure that we have people can get the insurance, the care that they need from a doctor they choose at lower cost. That's what we needed with health care reform. That's what we didn't get with Obamacare. We got higher costs. We got lower, fewer choices. Across the board right now, Madam President, it looks like in 7 out of 10 counties in this country, people are down to 1 or 2 choices. Hardly a market. In many places, a monopoly. And now, after the news that came out yesterday from Anthem in Ohio and some of the news that we see from Iowa and neighboring Nebraska, we all may find many places are going to find themselves where there may be no options available. So even with the subsidies that the Democrats have promised to help deal with high premiums that they have caused, there may be nobody to sell the insurance even when the subsidies are available. So I just come to the floor, as I do just about every week, Madam President, to talk about the situation with the Obama health care law, the challenges that the American people face, and our commitment to help provide relief and rescue the American people from what has happened to them under President Obama's health care law. Thank you, Madam President. I yield the floor.